In today's topic, we will gonna talk the pharmacological actions of a peptide hormone called insulin. First, what is insulin? In a simple definition, it is a protein chain or simply a peptide hormone which controls the amount of glucose, specifically sugar, in the blood. This peptide hormone is produced by the cells in the organ called pancreas, specifically, the islets of Langerhans. The figure 1 in this slide explains the biological process of how insulin is produced. This peptide hormone insulin is required in the body to functions the bodily systems normally. Since we already discussed what is insulin, let's proceed to the pharmacological actions of this peptide hormone. This binds to specific cell membrane located receptors, thus regulating the movement of glucose from the blood to the cells. Because of that action, there will be an entry of glucose, amino acids, and potassium ions into most cells. After that, there will be a reverse of hyperglycemia of diabetes mellitus through allowing the excess glucose to become intracellular. The figure 2 illustrates the normal blood glucose and high blood glucose happening under the process called hyperglycemia. Still on the pharmacological action of insulin, the protein synthesis is increased and the glucose is phosphorylated by ATP and hexokinase. It is used to derive energy into glycogen. This all takes place inside the cell. On the other hand, the storage of carbohydrates is further aided by the inhibition of the action of the enzymes of glycogenolysis, the process of breaking down glycogen into glucose to provide immediate energy. Figure 3 illustrates the glycogen structure. Peptide hormone insulin also facilitates fat deposition in the body. It also inhibits lipolysis, a process of breaking down lipids, specifically a triglyceride, into a free fatty acids and glycerol. The protein synthesis is aided by the impairment of gluconeogenesis, a synthesizing process of glucose from non-sugar precursors. Some of the actions of insulin include the following. First, the increased of glucose uptake into muscle and fat, meaning it helps with muscle protein synthesis, in which a body builds up muscle. Second, the increased of glycogenesis, meaning the insulin helps to store energy within the bonds for the future use. The third and fourth actions, the decreased of glycogenolysis and gluconeogenesis. If this happens, there will be a release of other hormones which helps blood glucose level back to normal. This process is important to patients in treating diabetes. The fifth, stimulation of growth, which is anabolic. With this, there will be a synthesis of complex molecules from simpler ones. This produces growth and building of the muscle mass. The next is decreased lipolysis. With this, there will be a lesser activity of breaking down fats in the body. It may cause weight gain to some who's taking insulin. The next action is decreased protein breakdown. When it happens, there will be a slow process of muscle protein breakdown in the body. Muscle remodeling is also slow, and there will be a possibility of a decrease of muscle mass. Those are the pharmacological actions of insulin in the body.